from Sharda Hospital as a host for this session, and thanks for joining us in this Facebook live session. September is celebrated as PCOS Awareness Month. Do you know that there is a common misconception that PCOS only affects overweight women? Dr. Ruchi Srivastava ma'am, who is a senior consultant, unit head and professor, Department of Gynaecology, is here to answer all your questions. Thank you ma'am for joining us today.
A very good afternoon to everyone, and thank you Dr. Mayuri for inviting me for such an informative session.
You're welcome ma'am. Let me introduce Dr. Ruchi ma'am to all our viewers and before we begin this session. Dr. Ruchi ma'am has 20 years experience and expertise in the field of gynecology and has been associated with Sharda Hospital over a span of 14 years. In today's insightful session, we will be discussing myths and facts about PCOS. So Dr. Ruchi, please enlighten our audience with some basic information about PCOS, which has become a modern epidemic. So ma'am, what is PCOS?
We keep calling about this name PCOS. First of all, I would like to share the full form of PCOS. It is polycystic ovary syndrome or polycystic ovarian syndrome. It is the most common endocrine disorder in women of reproductive age. We call it polycystic ovary syndrome because of the multiple cysts which are present in the ovaries. It is about 2 to 9 millimeters of the cyst, and that is the name which has come up because of this. And the primary characteristic of PCOS is hyperandrogenism, that is the excess of the male hormone. I would like to share that every female has a small percentage of male hormone for the better functioning of the body. But if the male hormone is in excess, it results in PCOS. Then there is anovulation. Anovulation means the ovaries ovulate every month. That means there is a release of mature egg from the ovaries, and if they get fertilized by the sperm, then the pregnancy continues. If they do not fertilize, then the periods occur. But in case of PCOS, there is chronic anovulation. The ovaries do not ovulate, and hence there is no pregnancy, and it results in infertility. Next is insulin resistance, which is also a very important component of PCOS. It's a hormone which is released from pancreas, and it helps in balancing the blood sugar level of the body. When there is resistance, there is disturbed blood sugar level in the body. And last is the neuroendocrine disruption. When we talk about the cyst, actually it is the sign of PCOS and it is not the underlying cause. Now coming over to the prevalence, because we have been seeing that every second person talks about PCOS. Sometimes the patient comes to us to the OPD and they say, ma'am, I have PCOS because I got the ultrasound done and I found that there are multiple cysts and this is PCOS. So you have to take a note that not all ultrasounds which show multiple cysts results in PCOS. So it has to be diagnosed properly. The prevalence is 4 to 18% in the worldwide population, but certain populations, they have as high as incidence of 26%. So it is very high incidence, and it is rather in a rising trend these days.
Thank you ma'am. As you have suggested that it is affecting the whole multi-system body. So what are the symptoms which we should look for and we should think that we might have PCOS?
Very rightly asked, PCOS has varied symptoms, but the most common symptom is the menstrual disorder. And if we talk about the menstrual disorder, the patient presents with menstrual irregularities, and most of the time they come up with the delayed cycles. They have delayed periods, and sometimes the periods do not happen for more than 3 months or 4 months or sometimes 6 months. So we call it as amenorrhea. In some cases, they may present with heavy menstrual prolonged cycles. Next comes is which the patient are more worried about are the unwanted hair growth on the body. We call it as hirsutism, and this is because of the excess of the androgens, that is the male hormone, and we call it as hyperandrogenism. The excess hair on the face is on the upper lip, on the chin, and on other parts of the body as well. It is in the male pattern, it is present on the chest, upper abdomen, lower abdomen, it can be on the upper back, lower back, thighs and upper arms. When we talk about hyperandrogenism, there is another symptom which is very common in young girls is acne. They are worried about this, but when we see acne, we are worried about her androgenic condition. They come with weight gain, and sometimes they also, if they are married, they come up with that they are not able to get pregnant, they find difficulty in getting pregnant.
Okay. So ma'am, with so many varied symptoms, how as a clinician you are able to diagnose it, and what are the modalities which we can diagnose this condition?
First of all, Dr. Mayuri, I would like to say that because the patient, they come up with the ultrasound report and they say, ma'am, PCOS ho gaya hai. So that is not the diagnostic thing. There is a criteria to diagnose PCOS, and we call it in our terms as Rotterdam criteria. There are 3 things, and we have to, at least 2 things should be present to make the perfect diagnosis. First is oligo-ovulation or anovulation. That means the ovaries are not ovulating. That means the ovaries are not producing mature eggs. So when the eggs are not mature, eggs are not produced, how can she get fertilized? She will not be able to produce, and pregnancy is far off from that in that case. Then is hyperandrogenism. In this case, as I said, the male hormone is increased, so she presents with hirsutism and acne. We have blood test also, but when the patient presents with hyperandrogenism features, so there is no need to go in for the detailed blood test, and only and unless when the doctor suggests you, then you have to go in for those tests. And the third is the ultrasound finding. On ultrasound finding, there are polycystic ovaries. The cysts are in the number of 12. Rather, nowadays we say that the cyst should be more than 25, and it should be of the size of 2 to 9 millimeters. When out of these 3 things, if even 2 are present, then we say it is PCOS. One point to mark here is that not just the ultrasound can diagnose PCOS. Sometimes the ultrasound will not show any polycystic ovaries. Still the patient is diagnosed to have PCOS.
Okay, well, thank you so much. So ma'am, why this is happening so much? What are the cause behind that our females are now facing this problem? Earlier we never used to hear it, but now it's like, why it is happening? Why is it becoming so prevalent now?
The cause behind is still not very clear, but after so many studies and researches have been done, but there's the combination of the genetic factor and the environmental factor come into picture, and they play a very important role here. When we talk about the genetic factor, that means the genes have been transferred from the parents to the children. So it is autosomal dominant. That means each child, if is affected by this, has a 50% chance to develop this genetic variant. So it can come either from the father. It is not necessarily that it will come only from the mother. So both the parents can be involved in this, and if it goes to the son behaves as asymptomatic carrier, and when the next generation comes up as a girl, so she can be transferred PCOS. And when we look at these boys, they have baldness, and they have thinning of hair on over the head, and excess body hair is there. If this genetic variant goes or transferred to the girl, she presents as PCOS. The next is the environmental factor, which also has important role in this. There are 3 things. First is the decision is taken place when the fetus is in the womb. What chemicals she's been exposed to, the mother is exposed to when the fetus is in the womb, and that we call it as a prenatal period. So whatever exposure is there, that comes into count. There is pre-genetic factor, and also there are endocrine disruptors in the society, the industrial factories which have come up. For example, one very common is bisphenol A, BPA. This is colorless, which gets soluble in many solvents, and when it is being taken, it stays in the body for a longer time, and it is one of the culprits which has been found out. and it is seen, it is present in the plastic, so which the cheap plastics which we use for a longer time, we use it in the microwave, we keep it in the refrigerators, we keep the food in the fridges. So they slowly they get dissolved in the food, and when we take this food, though it is a homemade food, a clean healthy food, it is getting toxins in it. It is getting toxins, so that can result in PCOS.
So we can modify this by not taking plastics, I think.
There are different plastic, because if you go and check out on those plastic bottles and boxes, they write over there PPA. You have to sort it out. It is BPA free. If it is BPA free, it is safe.
So this is a good tip, and we can follow that. So ma'am, the biggest fear is about, does this PCOS affect fertility also?
Yes, of course. PCOS is one of the major causes of infertility rather, and as I said, the eggs, they ovulate every month. In PCOS, I very clearly have announced or said that anovulation takes place. Rather, there is chronic anovulation. Chronic means for a longer time, the ovaries are not ovulating. If the ovaries are not ovulating, the mature eggs will not release. If the eggs will not release, how she is going to get fertilized? There are other factors as well. In PCOS cases, the oocyte quality becomes poor. That is, the egg quality is not so good. And there is endometrial abnormality, implantation abnormality has also been seen.
So ma'am, if someone has PCOS and they are trying to conceive, they should consult a fertility doctor if they are not able to conceive, if they are trying for a long time.
Yeah, I said, Dr. Mayuri, the first of all, we have to finalize the diagnosis of PCOS. When we are talking about infertility and PCOS, both are different entities but related together in some way, in some form. So PCOS has to be diagnosed first. This can be diagnosed by the gynecologist, and once it has been diagnosed, and the infertility is because of the chronic anovulation, this we have to find out. If it is because of chronic anovulation, your fertility doctor will give you certain medicines so that the eggs starts ovulating every month. So the most common medicine I would share is clomiphene citrate, and it is given during the periods. And not only this, after this, they have to keep in touch with the doctor. They have to go in for the series of ultrasounds to see that how mature the egg has gone, and then certain injections are given, and further management and the follow-up has to be scheduled.
Ma'am, should we consider that if a woman has a PCOS and if she's pregnant, she's high risk?
She is not exactly high risk, because definitely in one point of time, because when we say the risk factor lies that she can have miscarriages and she can have preterm deliveries also. So the pregnancy has to be monitored well.
So it should be supervised by a good doctor. So the message is that if you are having PCOS and if you conceive, then you should definitely be under supervision of a good doctor, because there may be certain medications which have to be added to prevent complications. There is one thing which is coming, that the pregnancy cures PCOS. So is it true, or is it just a thing like that?
No, pregnancy has no role in curing PCOS. Rather, PCOS has no cure, because it is just the symptoms which we treat. So pregnancy has no role in curing PCOS. Even after the patient has become pregnant and she delivers, she can have this problem later on also. So the symptoms can arise and she can have problems.
So ma'am, can we say that it is a lifelong disease which we are going to fight?
Very rightly said, because as I said, it is a genetic component is there. So when the fetus is in utero, that time sometimes it is decided that this girl will have PCOS because of the genetic variations. And when in the childhood, the eggs are not active. So when in puberty she comes in puberty and the ovary starts functioning, the symptoms they produce, they come up. And once she has crossed that age, she has come into the reproductive age where she has to get pregnant, the infertility comes up. Not only this, even after menopause, the androgen levels are seen in high amount, and there is insulin resistance. So when it is there that time also, so then also she can have those medical disorders and medical problems which can come up. There are many medical disorders which are associated with PCOS which can happen at any point of time. So the medical disorders, the first is the insulin resistance, which can lead to impaired glucose tolerance, which can also cause diabetes mellitus. It's a very high percentage later on in life. Even in menopause they can develop diabetes mellitus because of PCOS. Very grave thing is endometrial carcinoma which can happen. First of all, endometrial hyperplasia is there, and if she keeps up in a follow-up, we diagnose it early and that situation doesn't arise. Then they can have weight gain. As I said, miscarriage can also happen. There is one word called acanthosis nigricans. These are dark, velvety, patchy skin over the groin, in the underarms and at the back of the neck. You must have seen some patients, they or female, they come up and they say there is a darkening at the neck area and they keep cleaning it. They do the scrubbing over there, but it doesn't go off. It is actually the underlying causes PCOS and the insulin resistance. So that is the reason. Even in menopause, the PCOS patient, if she had earlier this PCOS, she can have cardiovascular diseases, hypertension, dyslipidemia at any point of time. Dyslipidemia is disorder of the lipid metabolism, that is increase in the triglycerides and cholesterols.
Thank you, ma'am. Since PCOS is a lifelong disease, ma'am, can you please help us or tell us the tips that, because taking medicine for a long time is very difficult, so what are the lifestyle modifications which these young girls can do so that this can be controlled naturally rather than taking medicines? Can we do something about it?
One thing, the first and foremost treatment for PCOS is not the medicine, it's the lifestyle modification. Lifestyle modification consists of two things. See, the risk of PCOS is because of the obesity and the lack of physical exercise, and of course because of the history of the family history of PCOS. So this family history we can't rule out. It has been inherited from our parents. But at least we can get rid of our obesity, we can go in for the physical activity. I recommend my patients to go in for a brisk walking every day for 20 minutes at least, and she should go in for a healthy lifestyle also. Healthy lifestyle like healthy eating. So those burgers, pizzas, fizzy drinks, they add on because they have a lot of carbohydrate, and we need a low glycemic index for these patients so that the carbohydrate doesn't interfere with all these things. So a homemade healthy food, go in for more of the fruit system, the boiled vegetables. So you have to reduce your weight, you have to keep a track, you have to be active enough. Why? What happens when insulin resistance is there? She has a craving for the food, and whatever is there in the house, she eats that. So try keeping those healthy foods in the house. And even despite of craving for foods, eating a lot of food, the energy levels it remains low. So they have to have a healthy lifestyle.
Okay. So the healthy lifestyle is the key, and you can consult ma'am for this condition.
One very important thing very interesting thing I would like to share here is that PCOS was first noticed in 1721 by an Italian scientist, and at that time nobody was knowing about this disease. And what he picked up that time, because it has come up in the notes and in the discoveries, that he picked up obese female who was infertile and was not able to conceive for a long time. Then he found out that her eggs were swollen up, her eggs were having a large volume, and he described those eggs as the egg of a pigeon egg. Interestingly, for next 200 years, nothing was done for this. And after 200 years, around in 1935, the final discovery of PCOS was done by Steen and Leventhal. I would definitely like to take their name, because this is PCOS month and we have to regard those who have discovered PCOS. Steen and Leventhal. And one interesting point about these two scientists is they both were born in Chicago, and they both studied in the same medical school. They were not knowing them, they were not aware of these things, PCOS, and then they worked for PCOS in the same institute throughout their life. So, and they finally have come over to the diagnosis of PCOS, which has helped us.
Thank you, ma'am, for this enlightening session. And before we conclude, there are certain questions in the chat box. So, can we ask them?
Definitely, I would love to take those questions.
Okay, so this question is from Neeti Sharma. So, what is the difference between PCOD and PCOS? So, what is the difference?
See, when we say PCOS, it is a syndrome. So there are multiple things involved with this. So as I said, it's hyperandrogenous, insulin resistance, there is central obesity, and neuroendocrine disruptions are there. So it's a combined metabolic syndrome. So it is a combined form of endocrine metabolic syndrome, which we call it as PCOS. So these days we use the word as PCOS.
So Neeti, I think ma'am has given you the appropriate answer. The next question is by Anuj Nair, and he's asking, does PCOS pass from mother to daughter?
As I said, Anuj, PCOS has a genetic factor and it is inherited from parents. So it can be inherited either from the father or from the mother, anyone. So if she has a family history of PCOS, because PCOS can only be seen in females, because fathers will not produce with PCOS, they do not have the ovaries. How they come up is they are just the asymptomatic carriers, and they have the baldness, the receding hairline, and excessive hair in the body. So it can be transferred from either of the parents.
So ma'am, the next question is by Bhavna Prakash. And she wants to know, does PCOS cause pain?
Yes, sometimes, in some cases, not always, PCOS can cause pelvic pain in some patients. So we have to examine the patient. Pelvic pain has many causes. So PCOS comes in our mind as a last cause. So if she has other causes, other symptoms as well along with this, along with the pelvic pain, we have to consider it. Yes.
The next question is by Shreya, and she's asking, do I have ultrasound to get diagnosed? Do I need an ultrasound to get diagnosed with PCOS?
Yes, Shreya, I said the diagnostic criteria contains 3 things which I have already elaborated in detail. So out of those 3 things, if 2 things are present, when we rule out other entities of these problems, there are other entities like Cushing syndrome, like hypothyroidism, hyperprolactinemia, congenital adrenal hyperplasia. There are certain words which we know and we have to rule those things out, and when these 3 things are present, out of these 3 things, if even 2 are present, then we have to consider, we diagnose it as PCOS. Yes, of course, the ultrasound is one of the major important thing when we have to take the consideration, because if ultrasound shows polycystic ovaries, multiple cysts in the ovaries, and there is another problem along with that, she has, suppose for example, she has unwanted hair over the body and with polycystic ovaries on ultrasound, we diagnose it as PCOS.
So the next question is by Riya Sharma, and she's asking, what will happen if I leave it untreated?
Riya, PCOS will not cause, in many patients, sometimes it will not cause any, it will not reflect anything, it will be just, it will go off like this, and sometimes you will notice it when you are trying to conceive and you find that there is infertility, then we diagnose it was because of PCOS. But when at any point of time, whether puberty or at reproductive age or later in life, if you have diagnosed PCOS, it should not be left untreated, because you have to take care of it. As I said, it consists of adverse effects. If the patient is obese, then there are adverse effects. She can have hypertension, cardiovascular disease, endometrial hyperplasia, insulin resistance, which can lead to diabetes later on. So it should not be left uncared. It has to be taken care of.
Ma'am, the next question is by Niharika, and she's asking, what can I do to decrease my PCOS symptoms? She is, I think, a diagnosed case of PCOS. So she wants to know what can I do to this. Although ma'am has elaborated.
Yeah, symptoms, okay. So PCOS doesn't have any cure. We treat the symptoms. The cure behind PCOS is the lifestyle modification, which we have talked about, that we have to go in for. And if you have been diagnosed with PCOS, you have to consult your doctor, whatever. There are certain many different symptoms. So Niharika, there is not only one symptom which PCOS reflects, there are many symptoms. So what symptom you have, what problem you have, so we deal accordingly and we treat with the medicines to the patient.
One question is asked by Priyanka, is PCOS a rare condition, which we discussed earlier, but they want to know how prevalent it is. I think it's a modern epidemic. Mama, what's your thought about it?
PCOS is not very rare these days. Every second woman, if you talk about, they have predicted themselves that they have PCOS, but the actual prevalence rate is 4 to 18% in the general population. Some say it is 10 to 15%, but average if we go in for, because I am talking about the worldwide population, it is 4 to 18, but it can vary from.
The last question I think is from Snigdha, and she's asking, does PCOS affect our metabolism?
Yes, it affects our metabolism and it can lead to metabolic syndrome. We have to check out on the central obesity, we have to check out for the insulin resistance. It is associated with the metabolic syndrome.
Oh, so we are not able to conclude. So another question from Monica Tyagi is, nowadays why do girls get periods very early?
This is not related to PCOS, but I would like to take this question because of the health, because of the lifestyle which we are going in through. With the activity has become less. The girls are becoming more obese in the pubertal age itself because of the more of the estrogen. Because the obese girls have more of the estrogen in their body, so that is the reason it can happen.
So ma'am, does PCOS worsen with age? This question is asked by Ruchi Srivastava. Does it worsen?
Because I would say yes. Why I would say yes? Because initially when the young age girls come to us, they are only worried about their menstrual disorders. And sometimes if they have unwanted hair or hirsutism, they talk about hirsutism, the acne. They are just limited to this problem. But when our vision goes beyond that, we think about their married life. If they get married, there is difficulty in getting pregnant. That is the very important issue. Even if suppose we have treated and the girl gets pregnant, the thing is not stopped there over it. Because after that, as the medical disorders are associated, so many medical disorders are associated with this, so she can have PCOS problems, related medical disorders later in life. As I said, even after menopause, she can have problems related to it, and the grave thing is endometrial carcinoma, which can happen after years because of this condition.
When I started, there was a question, did you know that there is a common misconception that PCOS only affects overweight women? So Priyanka is asking, if you're overweight, then only you are PCOS?
Yeah, very nicely I would say this question is because this is a myth which we carry with us that overweight females have PCOS. It is exactly not the situation, because 80% of the obese, they have PCOS, but remaining 20% we call them as non-obese PCOS or lean PCOS. The problem here with this, that with obese PCOS, the adverse outcome is not so good. As I said, there's hypertension, insulin resistance, and so many medical problems associated with this. Whereas in lean PCOS, the diagnosis is quite late, because we have the tendency, okay, and most of the patients who come to us are obese only. So when she's a lean PCOS, if she has an irregular menstrual cycle, so there are many causes for irregular menstrual cycle. So we try to find out those other causes as well, and the treatment also gets delayed in these patients. Sometimes these patients are picked up when they are not able to conceive, and when we find out the cause of the infertility, there are so many causes of infertility, we find out, we rule out each and everything one by one, then we come over to PCOS, and then that is the final time we say, oh, isko to PCOS tha, and she was not even able to know about it, even sometimes it is missed.
So this was the last question for this session, and thank you ma'am for sharing such great information about PCOS. I hope our audience will benefit from this session, and I conclude the session now.
Thank you, Dr. Mayuri and the entire team for inviting me here. I really enjoyed this session. It was a wonderful Facebook Live session. Thank you so much.